Angelman syndrome primarily affects the UBE3A gene. Over the last 3 decades, we learned quite a bit for the function of this gene. It's making the connection between two neurons. That's called the synaptic function, which is making one neuron talking to other neuron.
So UBE3 is crucial for the brain development. It impacts a lot of our cognitive function, our communication, and also motor functions.
There's a long list of symptoms associated with the Angelman, including the very severe end of intellectual disability. And these kids are very severe, they don't talk at all, and there's no language. Then they have some called a movement disorder or ataxia, which basically is the abnormal gait when they're getting older. Then more frequently they will see the epilepsy or seizure and happen usually after 3 years of age. Typically, pediatrician or family or parents will notice the problem roughly around 6 months of age. However, to confirm this one, rely on the genetic testing. Many genetic conditions, only one type of genetic defect. For Angelman syndrome, it's at least 3 types, including a large piece of chromosome missing in the chromosome number 15 region, and also including very called a misspelling for the gene UBE3A. They're also very sophisticated epigenetic defect too.
It's resulting one copy of our gene, either from our mother or father, gonna express in the offspring. So for the UBE3A, it's very unique because only the mother's copy we get for our neurons in the brain can be expressed.
It's very important for family or physician understanding which type of this Angelman syndrome and what molecular defect. That only can be done by genetic testing. So we have our Yale DNA diagnostic lab. We are capable to identify all different types of the molecular genetic defect for Angelman syndrome.
If we have the very clear specific diagnosis through the gene testing, it could predict what's going on in the future of life and provides us more accurate information and guiding us for the treatment.
Unfortunately, similar to many other neurodevelopmental disorders, there is no FDA-approved specific treatment for Angelman. But emerging molecular therapy could be specific for Angelman, including gene therapy and also potentially the future for CRISPR editing. My lab is dedicated to understanding molecular or neurocircuitry basis for neurodevelopmental disorder primarily caused by genetic mutations. So we work on a panel of conditions. So Angelman is definitely one of the exciting one, also one of the long-lasting one since my training. Over the last 25 years, my lab and many other labs in the world actually contribute to understanding we call the pathophysiology or molecular mechanism for the Angelman. Eventually leading to right now, we know how to target the use of CRISPR, primarily in a neuron-specific way that can help this Angelman patient.
The paternal allele is silenced, but it's intact in our genome. So the same for the patients, as long as they have the intact genome from their daddy's side, we still can restore the expression of UBE3A from the paternal allele.
It's very promising for this particular delivery platform for future CRISPR editing, good for Angelman syndrome, potentially good for many other neurogenetic disorders too. Working with a collaborator, Professor Jianbin Zhou in biomedical engineering, we're working on the basic science and our translational science to conduct clinical trial. So that would definitely attract the patient or offer an opportunity for Angelman patient all over the world to come to Yale to get this very cutting-edge treatment.